start the ceremony. We also welcome Ambassador Blake from Uganda. So, dear Minister, dear Excellencies, dear nominees, dear members of the jury, dear colleagues, ladies and gentlemen. A very warm welcome to all of you on this third edition of the prize. We have the very great honor to welcome, as I already said, Minister Miriam Kitir, the newly appointed Minister of Development Cooperation. She's here tonight for the award ceremony and she will hand over the certificates. I hope that most of you had the time today to visit our renovated museum. If not, please come back. Today you're visiting the museum, but in fact we're a major research institute on Central Africa. Our museum has 80 scientists, both in the fields of human and natural sciences. We do a lot of training. Every year we train on average about 150 African scientists in our work. We have field programs in 12 African countries. But as I say, today we will talk about more of our activities for the public. And let me say a few words about the Digital for Development Prize. We've already organized it in 2016 and in 2018, so we do that every 2 years. And why did we do that? Because of the increasing importance of digital solutions in the sector of development cooperation. And for those of you who've already read the new agreement of our government, you will see that there's a lot of emphasis and attention in that agreement in the field of digitization and digital solutions. In 2016 and 2018, we've organized an innovation fair and a networking event on the occasion of this award ceremony. Unfortunately, this was not possible today given the current COVID-19 pandemic. And today is a very unusual way of organizing this ceremony. I mean, usually we have particularly our partners from the South coming. Obviously, for reasons of COVID, they were not able to travel. So today we have primarily the partners from the North, from Belgium, who are here today. That's very sad because usually we invite the people from the South, come here, they stay a week in Belgium, they visit partner organizations. So that's something which is different from the past. And also we had to, for logistical reasons, we had to have the jury meeting for the final selection today and immediately after the award ceremony, and it's only at 6:01 that the jury reached consensus on the names of the winners. So it was not easy. And in fact, for today, we prepared, because we have 11 candidates, we prepared 11 speeches because we didn't know in advance who would win. And so at 6:01, we had to start cut and paste and put the right text with the winner. And if tonight there is a mix-up that at some stage we realize that we cut out the wrong pages, please bear with us. It's a rather unusual situation. For this edition 2020, the submitted projects are linked to 25 countries. 95 of them were African countries. And it's clear that this prize is a networking event because of all of the projects that were submitted is a close partnership between North and South. So this third edition, you can truly speak of a digital edition. We invited the South partners to participate in the presentation. Sometimes it went well this afternoon, sometimes it didn't go so well. Also now tonight it's sort of being streamed, so we hope that several South partners will be able to participate in this ceremony. A very warm welcome to all of them, and a very well welcome to all of you. And I would like to invite Minister Miriam Kitir to address you. And thank you very much once again, Madam Minister, for being with us today. Let's give her a big applause.
Good evening, everybody. Let me first start by thanking the Royal Museum for Central Africa for inviting me today to be present for the third Digital for Development Award. In this coalition agreement, the newly appointed Belgian government rightly recognized the important role for digitalization as enabler for the activities of the Belgian Development Corporation. As Minister for Development Cooperation, I think our most important role is to support our partners in building inclusive society with strong social structures that are based on the principle of solidarity. Such structures can create opportunities and empower people by providing better access to education or decent work, and are also there when things are not going well, by providing access to qualitative healthcare and our social protection. Setting up such structures is, of course, in the first place, a role of for the government, but they can also be built bottom-up by civil society organizations or even with the support of the private sector. Digitalization is an important enabler for the creation of such initiative and illustrated by the inspiring projects presented here today. It facilitates the building of networks and allows social structures to reach more people, including vulnerable groups, and have more concrete impact in the field. I therefore fully subscribe to the importance given to digitalization in the context of development cooperation. Due to the global COVID pandemic, I understand that it was unfortunately not possible to have a larger representation from our partners in the South here today. COVID is impacting all of our lives, and even with less alarming infection rates than here in Europe, the population in the South risks, unfortunately, to be hit hard by this crisis. This pandemic has sparked an economic slowdown, and according to the World Bank, global extremely poverty is accepted rising in 2020 for the first time in over 20 years. Addressing this challenge will undoubtedly be one of my short-term priorities, and digitalization is an important ally in that regard. In time, when social distance is the norm, digital solutions are an essential part of the response to fight the pandemic and this impact on societies. For example, by providing access to distance learning or healthcare. The pandemic has in that regard also here in Europe facilitated the acceptation and breakthrough of digital solutions. Belgium has been a global and a European forerunner in promoting digital solutions for development. And I was very happy to learn that our pioneer work has been inspirational, and it is now being followed up by other countries and institutions like the European Union. It illustrates that we can make a difference even with limited means at our disposal. Thank you for your attention, and let us now, without further ado, turn to the presentation of the awards.
Thank you very much, Madam Minister, for your support and for a very interesting presentation. We will now give the floor to the nominated projects, and I will ask Christina de Heren, to present each one of the nominees. Thank you.
Thank you very much. We'll first welcome the I Choose category, and we'll start with well, I will call all nominees from I Choose category to come here, and the ones who present their project come here, and the other ones wait at the other side. You have 3 minutes to present your project. the first project who will be now presented is Bambanani, joining hands to teach every child open education resources in South Africa by VVOB.
Do I start the video? Or?
I let the learners learn and work together in groups, because when they're working in groups, they get to feed off of each other's ideas, they get to reinforce each other's ideas, and you find that if it's in mixed ability groups, the weaker ones find and get some support from the stronger ones, and the stronger ones get a chance to actually extend themselves.
Maybe we could cut it into thirds. Wait, guys, I know. We can cut it into strips, like 3 strips. Strips! We can cut it into strips.
I let the learners
Well, don't be afraid, this is not a mathematics lesson. I wouldn't dare to start an evening with that. What you just watched is a snippet of from one of VVOB's Bambanani videos. So like many places in the world, the classrooms in South Africa are very diverse. And Bambanani is a video series that supports teachers to really embrace that diversity and to strengthen their inclusive teacher practices. So every child has the right to quality education. And Bambanani provides teachers not only with resources, but also with inspiration on how to stimulate participation and learning by all. So the series is developed in a very close partnership with the government of South Africa, and it's available to all on YouTube. The videos are open education resources under a Creative Commons license. And since their development in 2018, the videos are continuously being broadcasted on television. And as a result, we are reaching over 2 million households in South Africa and over 9 million households in sub-Saharan Africa. So we are very aware of the fact that thanks to D4D, the potential of these videos goes far beyond South African schools. So if you or your organization wants to watch these videos, or even better, to use these videos, it's possible. You just go to our website, vvob.org, and there is a direct link to all videos, free to use. And by watching them, you will be exposed to, well, let's say, an exciting world of inclusive teaching strategies. So every learner can grow up to fulfill their full potential, unique as they are. Thank you.
Let's now discover the other I Choose project by Trias in Uganda, which is called Financial Inclusion for Ugandan Farmers and Entrepreneurs, presented by Hannah van der Stegen.
Good evening to you all. So my name is Hannah, and I here today am honored to present Trias and our team and our colleagues in Uganda and their project on mobile banking, and I thought who better to explain it than themselves.
Robert Mubisa, I work with the Trias Uganda as a microfinance advisor. In 2018, we started on a project of digitalizing finance services amongst the 4 microfinance partners we're working with. This has, in in the long run, brought the cost of doing business for these MFIs because they no longer have to spend as much as they used to spend on operations. And on the side of the beneficiaries, it has also reduced the cost of borrowing because they used to move, spend on transportation to come to this MFI, and that's not anymore possible. And whereas we are in the future looking at improving, developing this further initiative of integrating digital learning. So the future is bright, and for us, so far, the project has paid off.
I'm Bob Muzora, sector.
Robert Mugisa, I work with the Trias Uganda as a microfinance advisor. In 2018, we started on a project of digitalizing finance services. Robert Mugisa, I work with the Trias Uganda as a microfinance advisor.
No problem.
In 2018, we
So
started
in
on a
short,
project
our
of
mobile
digitalizing
banking
finance
system
services
in Uganda
amongst the
reaches
4 microfinance
the
partners
West
we're
Nile
working
and
with.
Bunyoro areas in
This
the
has,
north,
in the long
and
run,
it is actually
brought the
specifically
cost of
made
doing business
to
for these
access
MFIs
rural farmers and
because they no
rural
longer have to
entrepreneurs
spend as much
so that
as
they don't have
they
to
used to spend on
incur the
operations.
travel costs of every
And on the
time,
side
each
of the
time going to their
beneficiaries,
SACCO office.
it has also reduced the cost of
And
borrowing
the
because
SACCOs
they
are our
used to
partners, they are savings and
move,
credit cooperative
spend on
organizations who
transportation to come to
specifically
the
target
MFI,
these people,
that's
and
not
they
anymore
offer
possible.
specific loan products. And now
And whereas
the members of these
we are
SACCOs
in
can
the future
access
looking
their
at
banking account and can manage
improving,
their
developing
loans
this further initiative
and their
of
repayments
integrating
through a
digital
digital
learning.
system that uses
So
USSD
the future is
codes.
bright,
So
and
you
for
give in
us,
just
so
a
far,
simple
the
code
project
on
has paid off.
your phone. It doesn't have to be a smartphone. And this
I'm Bob
then will
Muzora,
allow you
sector
to check
manager,
your
Madifa Sacco.
transactions, to
We
check
introduced
your
the digital
account
financial
balance.
services with support from Trias Uganda,
There the video is.
purposely to expand financial inclusion in rural areas by enabling our members to access their accounts at low cost in terms of time and transport.
And last project
Since
from
the
iTrust
introduction of
category,
these digital
but not
financial
least,
services in
Impala
2018,
EdTech
our
Paraku,
membership
a
has
project in
increased by
Benin
about
presented by
15%
Martin Mbaga.
from 12,000 to over 14,000 to date, and our savings have increased by over 92%.
Good evening, everybody. My name is Martin Baga. I am a Belgian ICT engineer. I am project manager in ICT at European Commission, but also volunteer expert in EdTech for Impara Bridge. Today I have the honor to present you our project Impara EdTech in Paraku. The project is implemented by 2 NGOs. The first is GERA, which is digital hub in the north of Benin in Paraku. And the second is us in Parabridge. And Parabridge is like a kind of network. Most of people are from diaspora, and we are digital entrepreneur, engineer, or STEM enthusiasts with a passion of digital for development. Being in diaspora gives us good knowledge of both digital ecosystem in Africa and in Belgium and in Europe in general. In Benin, till now we have 2 main partnership, local partnership. Is the Ministry of ICT. We start with the Ministry of ICT, and now we are working with UNFPA. They advise us technically, and they support us in logistics. These are pictures of both teams. Oh. Okay. Our objective in general is to empowering youth through digital education in Paraku, but also in rural area around Paraku, and maybe in the future in Benin, why not in West Africa? And more specifically, what we do is providing training and support first teacher, to allow them to innovate and to use ICT in their courses. We also encourage youth job seeker to create like startup in education, digital education sector, and also to become what we call tech educator. Currently, school need tech educator. more during this COVID pandemic. For students, we provide them skills they need to what they call 21 century skills. I think most of you know that. That skills, they will need it in the future for the job. It's like creativity, critical thinking, and etc. So we contribute on SDG 4, 5 because we focus on girls, and 8 because we create jobs. So in practice, we first train those youth in herb. We teach them how to share their passion of digital and how to teach teacher. And in second phase, we connect them to the education ecosystem. Yeah, it's not easy because the education ecosystem, I call it, is heavy. It's like heavy. It's not something agile in Africa, but not only in Africa, maybe even in Europe. So it's not always easy to connect those youth to the education ecosystem. The advantage is I already told you, to create jobs, but also to promote the creation of local content, which is really a problem. So those youth will learn how to create content, and after they will teach it to teacher. We also save time by working with digital hub, because in digital hub you have a lot of youth who already know how to deal with laptop, how to manage social media, and it is easy for us to gain time, I can say that. And we found also that it's important to connect those youth to students, because the students can already start talking about entrepreneurship, what we can do in digital, and the earlier we do that, and the more we can make them entrepreneur. So here you have a picture of our team, our girls in Parakou. Material, we use common material like laptop. We need a lot of laptops, so thanks to our partner who provide used laptop, robots, and since this year, we need VR equipment because we are working on a big project to introduce VR in education. We need book also for teacher. Challenges, yeah, we have a lot of challenges. We try to face them. The first is the lack of material, lack of structure, and the rigidity of the ecosystem. I already told you that. The low level in ICT for teacher. We have to teach them from the basics, how to use a laptop, and expect them to use ICT in their courses. Is a long path. Generation gap, yeah, not easy to tell a off to teach those all the teacher, and make the business model sustainable. Yeah, we are working on that. So, yeah, thanks.
Let's now discover the I stand out category, the success stories. We have 4 different projects, and we'll first listen to Data to Care, a project by Savix, a Belgian startup, and active in Cameroon, Democratic Republic of Congo, Morocco, Niger, and Zambia. And so Xavier Morel, the floor is yours.
Thank you very much. Good evening all, I'm Xavier, co-founder of Savix. What we are doing at Savix is we are trying to help governments in low and middle income countries to help them to shift their operations in the healthcare business from a paper-based perspective to a digital data management. And we do this especially with our software Data to Care. So I'm discovering those slides because that was not, okay, that's here. First, we worked with a team. We founded the company based on what you have seen and the need that we have understood. We founded the company in Brussels in 2016. We defined ourselves as a social startup. We also said we would develop the health information systems in all the countries that were needed. Today we are in 15 countries in Africa and Southeast Asia. We are connecting many labs and clinics together to make sure that information can pass from one side to the next and that there is a kind of flow in the information. We are very proud of being 40 today after 4 years of being into the business. And we are kind of trying to be, and that's sometimes difficult in those times, but we make it. We are profitable each year, and we make sure that we stay like this to make a sustainable business over time. And then also from a management perspective, we make sure that we are kind of innovative. We have a very flat structure. The teams are self-managed, etc., etc. The pictures you see at the back is a picture that taken in Kigali, where we have an annual gathering with all the colleagues, and we meet and enjoy our time all together there. But that team is mainly building products, and one of the products is data to care. So the first, what does data to care do? We have to implement data to care in many laboratories. Those laboratories can be remote in the bush, and if you don't have any internet connections, we will use SMSs to send the data out of those laboratories. Once the data is sent to the central server located at the Ministry of Health, then people can decide, and as you would expect with COVID today and the crisis, you do a test and you expect to have in real time your results available at the Ministry of Health. This is what happens in all the countries where we are in. And once the country has the information, they can take active measures to counter the sicknesses they want to track. We worked at the country level and with aggregated data, but we also work at the patient level, and we help their physicians, clinicians, and patients to access their data. And this is also what the system enables. So as you are tested with COVID, the patient receives also an SMS with his test results, etc., etc. So this is about the product, and now how that product, has been distributed. We started to work in Benin, and then we went to Cameroon, and then to Ivory Coast, etc. Now we are present in 13 countries in Africa. We are covering a bit more than 500 labs today, and with those 500 labs, we are monitoring more than 2% of the all TB cases, tuberculosis case worldwide. And I talk about tuberculosis because that's a sickness where every year 1,500,000 people are dying every year because of that sickness. And that sickness is preventable, and we can cure it also. So based on that fact, we believe also that with the new contracts that we can have next year, we will cover 5% of that cases of tuberculosis cases worldwide in 2021. So we achieved that also because we are supported by many international support that we receive from many large organizations, such as also Enable. And so thank you to all these, and thank you very much to you.
The second project we're happy to show you is NutriApp, application for consumers to consumers for a better world. And it's a Peruvian Consorcio Arqueológico Peruano and Eclosio, a Belgian organization. And so we'll give the floor to Sibylle Nion-Préjean and Céline Jourdebec.
Good evening, everyone. Yes, we are going to Peru now. Did you know that in Peru, more than 1 in 5 children are overweight? And the situation is even more alarming in big cities, and especially in Lima. And these figures have been increased sharply for the last 10 years.
Until 2017, mainly because of the food lobby, Peruvians didn't have clear information on content of their food in terms of fat, sugar, and so on. And many thought they were eating healthy food, but it was not always the case. However, a law required companies to label their products with nutritional information, but this law has never been implemented.
Then, faced with government inactivity, our partners, the Consorcio Agroecológico Peruano, decided to act.
They developed a totally free application that allows you to scan products. This application is called NutriApp. It shows clearly if a product has a too high level of sodium, saturated fat, or sugar. And in addition, the application offers advice on diet and health. But let's take a look at a video to see how it works.
So now, what are the results for NutriApp?
NutriApp was a huge success. After only 6 months, more than 100,000 people knew or used the application. And the consumption of highly processed food has also decreased, especially for children. 63% of consumers say they will reduce their consumption of food labeled with octagon, and 21% will stop eating them.
Last but not least, the most important is the impact in terms of national advocacy. Since the boom of NutriApp and the mobilization besides, the government now requires companies to put on each highly processed food to put the octagon and so on. Now Peruvian consumers have the right to access to correct nutritional information. In a nutshell, NutriApp's success and impact is the evidence that civil society can be powerful for the common well-being via inaction by consumers, for consumers, using digitalization. We thank you all.
Now the third project is called Smart Glasses for Telehealth to improve access to quality healthcare, a project active in Democratic Republic of Congo and by MEMISA and Aristic. And we are welcoming Steven Cernils and Elise van Belle van of MEMISA and Steven Cernils of Aristic.
Thank you. These are the smart glasses, but we first have a video, right?
Bonjour, soyez les bienvenus. C'est Lilia.
Small movie we made when we visited Congo DRC in March, just before COVID. together with Clemente, who's here in the room. What you have to imagine, what you have to, what you have to, can you hear me? Yeah, it's fine. No, I'm recording. Oh, but then you have to, yeah, thank you. What you have to realize is that it's the nurse in the rural health center who's wearing the glasses, and it's connected with a phone, any phone, and she invites the patients, and she decides when she will call the doctor. And through WhatsApp, they connect a right time in 5 minutes, 10 minutes, 15 minutes. And when she has done the intake of the patient, she connects real time, live with the doctor who's behind his PC. And they kind of together investigate the patient. And it's not only the quality of care that has gone up, but also the training capabilities, the connection between the nurse and the doctor that has ameliorated significantly. We as Iristic, we are a for-profit private company. We are an innovative company that developed this tech solution, but in our shareholder agreement, right from the start, we decided that we would also use this technology for tech for good, next to tech for business. Of course, we also started to realize some time ago that tech alone can be a lever, can be a catalyst, can be a major catalyst, but that tech alone will not do the trick. So it's the whole community, it's the people on the ground, it's MEMISA, it's also others like ITG, ITG, that are our partners in making this happen and in fact doing the hard work all together. So maybe you can say something from the perspective of MEMISA.
For MEMISA, this was a very unique and innovative initiative. And it clearly shows that telemedicine can improve access to quality healthcare, also in low-resource settings, also in rural areas, in these remote areas that you saw in the video. And it also shows, and I think that is important, that a collaboration between an NGO, an academic institution, and a private for-profit company can have its benefits, and that it can be a real win-win situation where everybody comes with their strengths, and the result is much more than the different parts alone.
And the last presentation of Iceland category is by Access Agriculture, Paul van Mele, training family farmers with video present in almost the whole African continent.
Distinguished guests, ladies and gentlemen, minister, ambassadors, I'd like to present to you Access Agriculture and how we are creating an impact at scale, making food systems more sustainable by allowing farmers to learn from their peers in other countries through video. One of the challenges that we address is that the overuse of pesticides and antibiotics is undermining both the future of our food production as well as the health of our population. Now, to remedy this, farmers, youth and women in particular, they need access to relevant knowledge that can help them produce in a more healthy, environmental friendly way. We have developed a specialized video platform that is open access, so anybody can download any of the videos for free. It's not related to YouTube or Vimeo. So this has been created as a special platform to allow people to download content that is of interest to them. We are a global content leader. We now have more than 220 training videos on many different topics, from livestock, crops, soil, you name it, in 84 languages. We deploy a unique set of communication technologies. The platform is one. On the top, you see the smart projector. which contains our entire video library without being connected to the internet. With solar panels, people can screen videos at any time of the day in any rural setting. And we try to impact at scale by nurturing an ecosystem of service providers and development organizations who make use of these free resources. Yeah. So we are not implementing projects on the ground, but we are a value-adding organization. Yeah, so we try to provide a service to any development organization on the ground. Since we won the award of D4D in 2018, we also started to develop a network of young rural entrepreneurs who we identify, we train them, we equip them with a smart projector, and we coach them over a period of 18 months for them to become independent entrepreneurs who bring relevant content to farmers as a business. Here we just show you a few quick numbers. You can see the decrease in pesticide use, the adoption of green technologies is pretty impressive because farmers spend less and they earn more. They are also more economically empowered and interested to engage in saving and loan associations. And finally, this is just a slide showing how many people have made use of our video platform. More than 3,000 organizations in the South are making use of our videos to train farmers. And because of the rich broadcast quality level videos, also media houses are interested to broadcast our content for free. So we don't have to pay and they don't have to pay for the content. And as such, they can influence the society in the countries where they operate. Thank you very much.
And now we'll present the last category, iStartup category, the innovative ideas. We have 3 projects nominated by the jury. And we'll first start with Akaboxitech, Digital Financial Inclusion. Akaboxitech is a project in Uganda by Akaboxi Limited and supported by Ondernemers voor Ondernemers. And we'll listen to Eugenie Nijhuis and Frans Verschelde.
Good evening, ladies and gentlemen. It's a pleasure to present you the projects of our friends in Uganda, the Akaboxi project. Eugenie and myself, we are volunteers of Ondernemers voor Ondernemers, and we support this project. We support it financially by giving loans, and we support it by coaching the teams who are leading the project. The project is created by the local people over there and fully managed by them. It's in the region of Bukongi, a very rural region. It's all about saving groups. Saving groups exist all over Africa, but especially in Uganda already for many, many years. Weekly, these people, mostly 80% female farmers, come together, and 20% young male farmers. They come together weekly to save money, to bring in some money. They do that every week, and they put that in a box. Akaboxi is the local word for box, the money where you put it in the box. That is happening the whole year round, and at the end of the year, they give the money back to the people with some interest that they received in the meantime. It looks simple, but it gave a lot of conflicts, difficult situations, when it's not clear where everything is gone, what exact the balance is of every member. There are about 30 members in each group. And there were a lot of discussions and sometimes very difficult conflicts. So the people of Akaboxi were thinking, what can we do to solve this problem? And finally they replaced that Akaboxi box by a digital system. A digital system, every group now has a tool, a digital tool, to bring in the savings, to follow up the savings, to see exactly what is the balance in the bank, because every week they put the money in the bank. For the first time, there is a direct relation between the community and the bank. And that's a very important thing for the next developments in this situation. Okay, we go to the second page, and the second page tells you what are the intentions, what are the targets for Akaboxi, what do they want to reach? Well, of course, first of all, a transparent financial management system to be sure that all the money is correctly booked and managed. But secondly, and that's even more important, when all these people, all these members come together every week, they spend almost the whole afternoon in discussing the problems of their community and in trying to find solutions for their community. They always do under the lead of an Akaboxi coach who is helping them to find solutions and to improve the way they are working. It are improvements in different levels. One of the improvements are that these people need money. Of course they need money, because they don't have any money at all to finance what they have to do as a farmer. So in the beginning of the season, Akaboxi is bringing money in the groups, and that money is discussed and decided on how they will be spent. So the money will of course be used to finance the inputs for the next season. At the end of the season, there is a reimbursement of the loan and everything is fine again. More important even is that they try to improve the standard of living for these people. Not only for the women who are in the groups, but for everybody who is involved in the community. And the result is that the reach of this project is going very far. Actually, there are already 24 of these groups working. These groups are using the microfinancing of Akaboxi, and finally the money that comes from Ondernemers voor Ondernemers. There are in every group about 30 direct implemented people, but that means 30 families. 30 families is about 150 people. Well, if you take that for 24 saving groups, you talk about 3,500 individual persons, so that's a lot. Trainings are also very important, and Eugenie, maybe you can tell something about that.
About the trainings about the gender. As a woman, as an entrepreneur, I was impressed by these two people, Joshua and Sarah, who gave up their comfortable careers. Sarah was a banker, to help women in local areas, to empower them, to give them access to financial institutions. And as you know, and Frans said it, in many studies it demonstrated that if you give access to a woman to improve their lives, it will impact 5 other lives. So this is, and you can see the ratios. So that is why we really, really believed in their work, and we think they need really some support and encouragement. Thank you.
Thank you.
Let's now welcome Ariane Keizer, project manager at Rode Kruis Vlaanderen, for the project First Aid Blended Learning, a project in collaboration with Red Cross in Rwanda.
Good evening, ladies and gentlemen. I hope you're all still sufficiently energized for this penultimate presentation. I will try and really try to keep it at 3 minutes. So perhaps we can go to the first slide. So today I want to present to you a project of the Belgian Red Cross Flanders and its implementation partner, the Rwandese Red Cross Society, to you all, which revolves around the future of first aid and how we can give first aid access and skills to as many people as possible. In order to illustrate our project, we have a little bit of a video prepared. So perhaps. I've seen this video about 1,000 times now, but it still makes me smile. To briefly summarize the concept, we have actually a long experience as a Red Cross working with first aid and implementing first aid programs with our partners in sub-Saharan Africa. But what we wanted to do is bring that to the next level, because there's always constraints on the number of resources that you have, and we wanted to bring our first aid materials to a much wider audience. So that's why we took our traditional evidence-based and contextualized first aid materials and put them into an app which allows you to train someone in the theory of first aid in about 3 to 6 hours, depending on how strong they are at digital skills or digital literacy. And then we bring that to a final conclusion with a 1-day in-class training instead of a 3 or even longer days of in-class training, which has, of course, significant advantages over a traditional method. If you would move to the next slide. In comparison to, perhaps show all the I think that's easier for this format, since I don't control the clicker myself. But in comparison to traditional methods, this first aid blended learning has a few distinct advantages. First, you can train a lot more people in first aid than you could ever do before, and you can ensure that those people have always access to the latest and scientifically sound teaching materials. On top of that, you can do it much more efficiently than you could ever do before. The same number of trainers can train up to 3 times more people. And because we work digital, all the training administration is also done in the app. So that also helps with the implementing partner to set up a database and to make sure that their accounting and bookkeeping is correct. And then finally, of course, because we also work digital, it's a great advantage to gather data. Because first aid is something that is well, very important, that can be implemented or used in a lot of different settings. And we ask our people who we train to report on their use of first aid as well. With that reported use, we can improve our materials further to ensure that they have the best available material for them to act. And we can, of course, in the future, hopefully draw inferences from it and even make some conclusions about where we can improve structurally the safety of cities and locations. Thank you very much. That was, in a nutshell, the concept. In case anyone would have any more questions, I know this is not the format, but you can always talk to me outside. Thank you very much for your attention, and have a nice evening.
And last but not least, I started a project called Open Chain, which will be presented by Bram Oers, who works for Ildepe in Tanzania. This is a Tanzanian project in collaboration with Trias also, and a Tanzanian organization called Mviwata Arusha.
Thank you, everybody. I'll already wait for the next slide. Yes. Perfect. Thank you very much. So yeah, I have the honor to present to you Open Chain, which is a collaboration between Ildepe and Trias, two Belgian NGOs, and and Viwata Arusha, which is a farmers network based in Tanzania, Arusha. So we are active in Tanzania, more specifically in Karatu district. And one of the key issues there is to design a good program, a good intervention. You need insight into the local challenges, strengths, and like who is doing what. But that information, that overview is lacking. We have to rely on our own research and our own experience to obtain this type of information. While on the other hand, there are many local stakeholders active in very close collaboration with their target groups, who also have a very keen insight into what is actually happening there. But then they have difficulties with disseminating their knowledge to a broader audience, and also they're not always aware of each other's existence. So yeah, they miss opportunities to work together. And of course, as you can see there, the logo is in the middle. So OpenChain is a platform who wants to connect these stakeholders to document their experience, to create insight into this district context, and then organize stakeholder action. So this is a screenshot of our prototype. Unfortunately, it's not as pretty as the other website I saw during the previous presentations. But it transmits the basic idea, right? So during service and stakeholder consultations, we gather data on these insights that local stakeholders have. And then we publish them on a public record on our platform, together with also documentation and reports to support those challenges they have. We already tested this prototype with partners and stakeholders. And to be honest, yeah, they put a lot of challenges there that we still need to resolve throughout the development of this platform. For example, we had some organizations working on the rights of women, youths, farmers and pastoralists. But for them, it's also very important, like how will the government be involved in this? And how can we make sure that this data is also legitimate and that we can actually use it to support new policy interventions? But also, luckily, there was not only challenges from the partners, but they also saw the potential of the platform. So it would offer them the opportunity to exchange with each other, to document their experience and disseminate it, to get insight into this regional context, and also to create partnerships and common agendas for change. After our testing events, one of our partners, Viwata Arusha, already got some phone calls from participants of these workshops with a question to already start working together on lobby and advocacy campaign on the microfinance law in Tanzania. And that is the power that OpenChain can have. Like by enabling all of these actions, it can be a catalyzer for better policy interventions. And that's it. Thank you very much.
Thank you, Christina, and all nominees for excellent presentations. You've now seen 11 presentations, and you wonder how do you choose between them? So let me give you a brief overview of the evaluation process that we organized before we announced the winners and before we asked the minister to announce the winners. For the categories I Stand Out and I Startup, we had 43 submitted projects. And we've gone through a fairly extensive evaluation process. Each project was sent to at least 2 peer reviewers who gave us their comments, and these peer reviewers were all external independent experts in the field of digital technology and development cooperation. As I said, each project was reviewed by at least 2, sometimes by 3 or 4 people if there was difference of opinion. And the basic criteria used for the evaluation were content, originality, use of new technologies, or innovative use of technologies. In addition, we had a number of strategic criteria like the development relevance, sustainability, the impact of the projects. We evaluate them. And we also looked at the way to link to strategic themes of the Belgian Development Cooperation through the strategic notes on digital for development. So things like better use of big data, digital for inclusive societies, digital for inclusive and sustainable economic growth. So based on the scores evaluators, in the first round, the jury of the prize Digital for Development, and the jury is composed of 19 people, we nominated 7 projects in the categories I Stand Out and I Startup. And so today all of these projects have been presented in front of the jury, and we had a very difficult task to select the winners in these categories. And then we had the third category, the public award category, I Choose. And there the general public could vote for their favorite projects. We had 6 candidates for the I Choose project. And I'm going to say the lockdown and Corona sometimes also has good aspects to it. We saw an increase of 50% of the number of votes submitted compared to last time. I mean, we had 1,718 people voting for the I Choose categories. And before I ask our minister, let me say as president of the jury that I would like to say a special word of thanks to the jury members. It was a pleasure and honor to work with such a motivated and constructive group, that I would like to thank them all. I'll quickly say their names so that you know who was involved in the jury. There was Hilde Aerts from DGD, Bart de Wolf from the Cabinet, Wim van Petegem from VLIR, Elena Fascila from ARES, Rafael Maldaak from ACODEF, Jan Kennis of the Institute of Tropical Medicine, Serge Beel from LVLVELF, Annelies Valquin from IMEC, Catherine van Eekhouten from Startups, Christine Kopers from BOSA, Maartje Houbrechts from the King Baudouin Foundation, Arnaud Leclerc and Maxime Hendricks from Wehubit, Grégoire Lurton from Blue Square, Frédéric Thibault from Agoria, Björn van Kouter van Ondernemers voor Ondernemers, Stefan van Hoof from ZS, Marnik van Hey from Close the Gap, Xavier de Bethune from Because Health, and Lode Brunel from the previous cabinet, from the previous government. It was a very difficult process. As I say, all projects were very good, those on the short list. And as I say, it's not until 1:06 that we reached a consensus on who should be the winners. So we're very thankful to all members of the jury for their contribution and expertise. But we will no longer keep you waiting, and I'm asking Minister Kittir to announce the winners in all 3 categories, please.
Exciting, eh? First of all, before I announce the winner, I just want to say a big congratulations to everyone. I was very impressed from all the projects that I have heard here. So now, let me start by the category I Choose, the public award. The highest number of the votes from the public went to the winner, Bambanani. Yeah. The Bambanani video. The Bambanani videos series illustrate how teachers are teaching inclusively in South Africa classrooms. The videos are daily broadcasting on television and reach over 2 million homes in South Africa and over 9 million homes across sub-Sahara Africa. The video focus on teaching numeracy and literacy in primary education and are available in English with subtitles in Sesotho and isiZulu and isiXhosa, I think. They are part of an online platform created by VVOB that include a digital library of videos, facts, cheats, articles, and teaching guides with the aim of inspiring South African prime school teachers and supporting them to embrace the diversity of learning the classroom. Big congratulations. The award for the winner is a cash prize of €5,000. In the I Choose category, the 2 nominees received not only many votes from the public, but also specific encouragement from our part for their very interesting work and ideas. Nominated by the public is Impalait Touch from Paraguay. And second nominee in the I Choose category is Financial Inclusive for Uganda Farmers and Entrepreneurs by Trias Uganda. Nee, nee. De ogen spreken, hè. In the category I Stand Out, the success stories. For the excellent work, the jury selected the winner, Smart Glasses for Telehealth to Improve Access to Quality Healthcare by Memisa and Iristic in Congo. This project seeks to create access of affordable and quality essential healthcare service for the population of Kungandu through the implementation of a telemedicine system with connected glasses. In the context of the COVID-19 pandemic, the need for quality telemedicine with appropriate infrastructure has been identified in Congo for both rural and urban areas. This project provides the solution. The award for the winner is a credit line of €10,000 to be used for activity towards further development of the project or the project teams. Congratulations. Let me also invite and congratulate the nominated project Data to Care by Savis Implement in Cameroon, Congo, Morocco, Nigeria, and Zambia. Data to Care is a software platform consisting of mobile, desktop, and web application that collects diagnostic, clinical, and operational data from remote laboratories and clinics and transmits it in real time to local, regional, and national stakeholders such as a patient, healthcare providers, and decision makers. Data to Care is currently installed in over 550 laboratories in 15 countries in Africa and Asia, covering the diagnostic test of 250,000 patients. Data to Care aims to improve diseases surveillance, clinical data management, and individualizing patients' care by strengthening health care systems in developing countries through innovative technology. Nominated also in this category is NutriApp, application from consumer to consumer for the better world by Consorcio from Peru. And last but not least, also nominated in this category is training family farmers in their local language with video by access agriculture and implanted all over the African continent. From the category I Startup, the innovative ideas for this startup with high potential developed complements by out for local communities and the promising proof of concept presented, the jury selected as a winner I Startup Aka Boxy Tech, digital financial inclusive. The award for the winner is an internship or coaching in an incubator to the value of €25,000. There can be only one winner in a category, but the jury wishes to encourage the very well-developed ideas for the two nominees in this category. We hope to hear more from them again in the future and wish them all the success. First Aid Blended Learning van de Rode Kruis Vlaanderen en Rwanda Red Cross Society in Rwanda. And congratulations also for their nomination as promising iStartup is OpenChain. OpenChain was launched by ILDP together with Trias and the farmer organization Mviwata Arusha in Tanzania. Up to you, President.
Stay there for a minute.
Okay.
I would like to thank you, Madam Minister, for coming here today and for sharing with us your insights and being willing to give this award. And so let me give this to you as a sort of token thanks. And I hope we'll be able to welcome you here soon as Minister of Development Cooperation for a visit of our institute and to get to know the trainees that we have here from Africa and that of the work that we do in Africa. But many thanks for coming tonight. It was a great honor, and let's give a big applause to our And finally, before I invite you all to go for dinner upstairs, I would also like to say special thanks to the two staff who've done all the work here today. Christina Daren, who's been the workhorse behind this prize. And special thanks to you, Christina, for all the work you've done preparing it. As usual, it was perfect, except some of the digital connections. Christina, unfortunately, is leaving us soon. She's joining another scientific institute. She's pursuing her career. Very much regret that. We'll have another opportunity to say bye-bye, but I ask you now for a big applause for Christina. Also have some flowers for you. There's water in it, so that's you wonder why there's a carton bag. It carries water because some people still have a special travel. And then finally, I'd like to thank Eva November, who's the head of our Development Cooperation Program, for all her efforts in organizing this today, and for you too, Eva. This time I'll ask to put them a bit closer. And by the way, thanks also again to all the members of the jury. We have a little present for each one of the jury members. We forgot to give, in our rush of trying to finish by 6, we forgot to give it to you. It's a book on colonial Congo. It just published, and it answers all your questions about what really happens in our colonial past. And so we have a copy for each one of our jury members, but I also have a special copy for our ministers so that you can prepare yourself for your next visit. It's just standard work, and it's if anybody wants to know about colonial past of Congo, Rwanda, Burundi, it's the book that I strongly recommend. It's the best scientists at the moment who've written in it. It's written in a very fluent way, all the questions that you have. So the members of the jury, if you just pass by Eva or Christina,